Assalamu alaikum. Thank you, honorable judges and respective audience. Assalamu alaikum. I am Mohammad Tariqujjaman. I am working as a research investigator at Nutrition and Clinical Services Division. Today, I am going to present our study findings titled Socioeconomic Inequalities of Low Birth Weight and its Association with Maternal Dietary Diversity. These results are driven from maternal, infant, and child nutrition program in Bangladesh. So low birth weight. Low birth weight is defined when the birth weight is below 2.5 kg. It is one of the leading causes of under 5 mortality. Globally, every year, 20 million children born with low birth weight. And 90% of these births are taking place in low and middle income countries like Bangladesh. And also eating diversified food in pregnancy is important for successful pregnancy outcome as well as the survival of newborn. Based on these topics, we searched different literature and we found that the evidence regarding the socioeconomic inequalities is scanty in the areas where the maternal, infant, and young child nutrition program has been implemented. Also, evidence of association between maternal dietary diversity and low birth weight is limited. Based on these knowledge gaps, we set our two objectives. The first one is to explore the socioeconomic inequalities of low birth weight. The second one was to determine the association between maternal dietary diversity and low birth weight. These colored areas were our study areas. We selected 26 districts in rural Bangladesh where different maternal, infant, and young child nutrition program has been rolled out. The study design was modified stepwise. This picture shows the sample selection flowchart. Initially, we included 16,936 ever married women and their under 5 children. But after applying different exclusion criteria, we finally reached 4,651 women of reproductive age and their under 5 children for our analysis. In this study, our outcome variable was birth weight. We categorized as low birth weight if birth weight below 2.5 kg, otherwise normal weight. We considered our exposure variable dietary diversity, low and high dietary diversity. Also, we included some important covariates like child age, child sex, and wealth index. We analyze our data based on descriptive and inferential approaches. We use the concentration index to measure the socioeconomic inequalities of low birth weight, and we did the cluster adjusted multiple logistic regression to determine the association between maternal dietary diversity and low birth weight. Startup 15.1 software was used to analyze the data. In the results in sample characteristics, we see that only 8% of mother or adolescent and the distribution of wealth index are in similar pattern. That means the 20%, almost 20% in each categories. The average age of children was 29 months and 48% children were female. This bar chart shows the socioeconomic inequalities of low birth weight. We see that in the poorest group, the low birth weight prevalence was 16.2%, and in the richest group, it was 10.3%. And the poorest richest ratio was 1.6, and the absolute difference was only 6%, but it was statistically significant. We use the p-value by using adjusted Wall test. This concentration curve indicated that the negative concentration index value, which means that the low birth weight prevalence is mostly concentrated in socioeconomically worst of group. That means the poorest group compared to the richest group. This forest plot is showing the results of multiple logistic regression analysis, and we found that the mothers who eat less diversified food, their chance of giving low birth weight baby is 30% higher. We use interaction term between mother's age and dietary diversity and found that the mothers, adolescent mothers with low dietary diversity, surprisingly 2.6 times higher odds of giving low birth weight baby. In conclusion, we can say that the prevalence was 15%, the low birth weight prevalence was 15%. We found recess forest gap in rural areas. We found strong evidence between maternal dietary diversity and low birth weight. Adolescent mothers with low dietary diversity had higher chance of giving low birth weight babies. We recommended that intervention strategies for reducing low birth weight should be targeted at the poorest household, as well as for improving the dietary diversity of adolescent pregnant women in the poorest household might be cost effective. The novelty of this study is that this is the first study to report the low birth weight in the areas where the large scale program has been implemented. This study explored the socioeconomic inequalities, provide evidence regarding the association between maternal low dietary diversity and low birth weight, focuses on adolescent mothers, their dietary diversity and low birth weight, and finally the implications of these findings is when the policymaker or program manager designs such type of intervention, they should focus these vulnerable groups. Thank you.